one pill is missed, the risk of pregnancy increases. Contraceptive injections are another type of hormonal contraception. Your healthcare provider injects a hormone into the muscle of your arm or buttocks. One injection prevents pregnancy for 3 months. You will need to see your healthcare provider every 3 months for an injection to receive continuous pregnancy protection. The birth control patch delivers hormones through the skin. The birth control patch can be worn on one of 4 areas of the body: the buttocks, abdomen, upper torso, excluding the breasts, or the upper outer arm. The patch is worn for 3 weeks. At the end of each week, a new patch must be applied. No patch is worn for the 4th week. Then, the cycle is repeated. The vaginal ring is a small, flexible ring that releases a low dose of hormones. The ring is inserted into the vagina and remains in place for 3 weeks. It is then removed at the beginning of the 4th week, and a new one is inserted at the end of the 4th week. The side effects associated with the vaginal ring are the same as other hormonal methods. However, vaginal irritation and vaginal discharge may also occur. The intrauterine device, or IUD, is placed inside the uterus using a short procedure performed by your healthcare provider. The IUD is a small device made of plastic. An inserter containing the IUD is passed through the cervix and into the uterus. Once the IUD is in place, you shouldn't be able to feel it. The IUD prevents pregnancy by causing a change in the lining of the uterus.
It's in the genital area.
There are 2 basic types of IUDs. One type contains copper and can be left in place for 10 years. The other type continuously releases a low dose of hormone. Hormonal IUDs come in 2 forms. One form must be replaced every year, while another can remain in place for 5 years. The IUD may have side effects. Some women experience heavy periods and cramps, especially during the first few months. Bleeding between periods may also occur. Rare but serious side effects of the IUD are infection or puncture of the uterus. The effectiveness of the IUD in preventing pregnancy is excellent. All of the contraceptive methods that have been discussed are temporary and reversible. However, there are permanent procedures called sterilization. The decision to be sterilized should only be made after careful thought and expert counseling. Both men and women can be surgically sterilized. Only one partner needs to be sterilized to prevent pregnancy. In the man, the tubes that carry sperm from the testicles are cut and tied off. This procedure is called a vasectomy. Afterward, the man can have sex as before and continues to ejaculate fluid.